So one of the most important facets, I think, of T-cell therapy and the ability of us to use T-cell therapy for our patients is selecting patients. And so this would mean identifying patients with a poor prognosis early on, rather than putting them through a series of unsuccessful chemotherapies, and referring them early on to a center that's doing CAR T-cell therapy. The reason I say that is chemotherapy tends to deplete normal T cells, and we need normal T cells to generate CAR T cells. So if a patient comes after 4 or 5 or 6 prior therapies and doesn't have any peripheral blood lymphocytes to collect, it may be more difficult to generate a product. So I think early referral of these poor prognosis patients who aren't going to be cured by second and third line chemotherapy regimens to a center that the referring physician can work with to arrange collection and then management while production is happening is the ideal approach. Early referral. I think that more patients will be candidates for CAR T-cell therapy than for transplant, in the sense that stem cell transplant requires that you achieve a remission prior to going to transplant. You can treat patients with active disease with CAR T-cells and you'll get the same outcomes as those that are in remission when they're treated with CAR T-cells. So that's an advantage to CAR T-cells. Similarly, patients who can't go to transplant because of, say, a comorbidity may still be eligible for CAR T-cells. For example, we treated patients up to age 79 on my trial with CAR T-cells. So age wasn't a barrier, whereas transplant, that may be a barrier. In general, I think there's more, a wider group of patients who are potentially candidates from the age and comorbidity standpoint with regard to CAR T-cells as compared to auto transplant. In my opinion, and I do both auto transplants and T-cell therapy, I actually think once you have the hang of it, and now we understand CRS rates, how to manage it, neurotoxicity, how to manage it. Once you get the hang of it, it's actually a lot less toxic and a lot easier to do this for patients than to do a transplant.